In the second part of this lecture, we will look at cardiovascular response to exercise. I mentioned before that it is our cardiovascular system rather than our respiratory system that limits our performance in exercise. But why did I say so? Let's take a look. So if you take a look at our cardiovascular system during exercise, you could see an increase in both parameters, which are our heart rate and the stroke volume. Heart rate refers to the number of heartbeats per minute, while stroke volume refers to the volume of blood pumped out from the left ventricle per heartbeat. And collectively, if you multiply these two parameters together, they will give you the cardiac output, which refers to the volume of blood pumped out from the left ventricle in a minute. And similar to ventilation, your heart rate increases just prior to exercise, and that is to get our body ready for the upcoming activity. So this is known as the feed-forward reflex or the feed-forward mechanism, which also happens in the control of ventilation. Okay, as mentioned just now, cardiac output measures the volume of blood pumped out from the left ventricle per minute. And the higher is your cardiac output, the better you can circulate those oxygenated blood around your body. If you remember, your arteries are always packed with the maximum oxygen PO2 level, which is about 100 millimeter mercury. So it is not a matter of getting enough oxygen through gas exchange, it is a matter of blood flow or circulation. So we normally have a resting cardiac output of about 5 to 6 liters per minute, but with increased physical activity, the value can increase up to 25 to 30 liters per minute for the trained athletes. Now, if you convert 30 liters per minute into ml per second, what is the value? It is equivalent to 500 ml of blood pumped per second. So that is an incredible volume, given that the size of your heart is about the size of your fist. But can this cardiac output increase forever? Of course, no, because it will eventually plateau off at the maximum value, which is the Qmax over here, and that is your maximum cardiac output. So why do we have a maximum cardiac output? Well, that's because there is a limit to the heart rate, which is known as the maximum heart rate. And heart rate is controlled by the sinoatrial node. It's basically a pacemaker and two sets of nerves. The sympathetic nerve that increases our heart rate and the parasympathetic nerve that decreases our heart rate. So to know your maximum heart rate is very simple. You can follow this formula, which is 220 minus your age. So from here, you can see that children or babies, they tend to have higher maximum heart rate than adults. But for sports person, you have to use another set of formula. So that is to calculate the maximum heart rate in both endurance and anaerobically trained athletes. Okay, here is a revision slide, and I believe you have learned something similar from Dr. Saha. So we have a resting heart rate of about 60 to 100 beats per minute. So the heart rate is again controlled by the sinoatrial node along with two sets of nerves. So the first set is the sympathetic nerves. They help to speed up our heart rate. So this is achieved by the release of noradrenaline, which is a neurotransmitter that will bind to the SA node. With that binding, that activates the CMP pathway, resulting in the influx of sodium and potassium ions into the cell, speeding up the formation of action potential and subsequently increasing our heart rate. Conversely, for the parasympathetic nerves, that act to slow down our heart rate. So that is achieved by the release of acetylcholine, which is another neurotransmitter that will bind to the SA node, which will deactivate the CMP pathway. With that, you have the outflow of potassium ions and subsequently a reduced heart rate. And now you may pause the video for a while to try this question. Why do sport persons have lower heart rates? And the answer is B. They pump more blood with each contraction. In other words, they have a higher stroke volume. So athletes acquire a larger stroke volume by training. Remember, the formula of cardiac output is heart rate times stroke volume. So when the stroke volume is higher, they just need a lower heart rate to achieve similar level of cardiac output. And now try this question to assess your own fitness level. And to interpret the results, you may refer to this table. So from this table also you can see how athletes are often having lower heart rates than the average people. And in the next slide, you will see why heart rate is the ultimate limiting factor to cardiac output and athletic performance. And now let's take a look at the control of stroke volume. So stroke volume increases with the intensity of exercise, and it increases linearly with the demand for more oxygen. But it will only increase up to a maximum point, which is the maximum stroke volume, before it levels off. So it takes a dip after the SV max with high level of physical activity due to a shortened filling time at high heart rate. So if you look at the heart rate after the point of SV maximum, you get very high heart rate, possibly close to the maximum heart rate. And that also means the time in between subsequent pump has become shorter. As a result, you get a shorter time to fill up the heart with blood and hence a drop in the stroke volume. So how can we increase our stroke volume? Remember, this is related to your cardiac output, and by increasing the stroke volume, you can enhance your athletic performance. Now, first of all, we need a higher contractility of heart that can be achieved by exercise when you are exposed to higher heart rate and higher circulation. And we also need an increase in the end diastolic volume or the preload, which refers to the degree to which the ventricles are stretched prior to contraction. So the higher is the preload, you get a larger volume for your ventricles. And last but not least, we'll need a decrease afterload, which refers to the pressure against which the heart must work to eject blood during systole. So when you have a smaller afterload, your heart can pump even more blood. So with these three factors being enhanced, we can then enhance our stroke volume and subsequently enhance our cardiac output. So you will get an increased cardiac output during exercise, but the distribution of our cardiac output is a very dynamic process. For example, when we are at rest, about 13% of our blood is pumped into our brain, 19% to our kidney, 24% to our gut, while 21% to our skeletal muscles. But during exercise, you get an immediate boost of your cardiac output from about 6 liters per minute to 26 liters per minute. And you also get a very big change in terms of blood flow distribution. For example, the blood supply to muscle has increased by tenfold from about 1,200 up to 12,500 ml per minute. And that allows your muscle to get more oxygen and also get more ATP production. And the blood supply to skin is also quadruple from 500 to about 2,000. And that is important so that heat dissipation can happen efficiently. On the other hand, you see a reduction of blood supply to your kidney and your gut simply because your focus now is to get moving. So this marked increase in blood flow to skin and muscle is the result of selective vasodilation. But how is it done? Well, we can redirect blood flow depending on the local need of oxygen. During exercise, part of our tissue can become hypoxic or lack of oxygen and acidic due to the accumulation of lactic acid. So these conditions can serve as the signals to stimulate arteriolar dilation or the dilation of arteries, leading to a higher blood flow. On the other hand, if you increase blood flow to certain tissues, then we need to reduce blood flow to other tissues such as your gut and your kidneys so that the overall blood pressure is being maintained. And this is achieved by the opposite mechanism, which is the arteriolar constriction or the constriction of arteries. And it is believed that both arteriolar constriction and dilation are also regulated by the hormone adrenaline that is produced during exercise. So with increased exercise, we can observe a reduction in peripheral resistance or the resistance within the peripheral arteries due to vasodilation. In other words, during exercise, you get a smoother blood flow within your arteries due to the dilation of your arteries. But overall, exercise increases our blood pressure gradually. So you get a higher increase in systolic pressure as both the heart rate and stroke volume are increased during exercise. But the diastolic pressure doesn't increase as much as it is measured when the ventricles are not contracting. And now we'll look at thermoregulation during exercise, or the regulation of body temperature during exercise. So you learn that in second law of thermodynamics, with each conversion of energy from one form to another, a portion of energy is lost as entropy, and a large part of entropy is the heat energy. So in fact, the conversion of energy in our muscle is only about 25% efficient, because 75% of those energy is converted into our body heat. So this process is known as thermogenesis, or the generation of body temperature. So to prevent from overheating, we get an increased blood flow to the skin, which is almost quadruple. You can see how blood flow to the skin has increased from 500 ml per minute to about 2000 ml per minute. And this is important to promote loss of heat. However, prolonged sweating could lead to dehydration, reducing our blood pressure, and eventually it can cause a heat stroke. So it's very important to stay hydrated throughout the course of exercise. So why should you exercise? Because that gives you a better quality of life, better health, and better control over your glucose level. So showing here are the results from the glucose tolerance test of a patient with issues controlling his or her blood sugar level. So as compared to the control, this person has a higher level of blood glucose when he was fed with a glucose syrup. But after having exercised for 7 days, you could see how the patient had a lower blood sugar level. And similarly, with exercise, you could see how this same patient had a lower plasma insulin level. That's because when the blood sugar level is under control, you also need less insulin to reduce the blood sugar level. So don't forget that insulin is also an anabolic hormone. So with less insulin, you also build less fats. And as a result, you could make yourself fitter and healthier with exercise. But of course, everything must be done in moderation, because having too little or too much of exercise can stress your immune system. So don't push yourself too hard and don't be too lazy. And I'm not sure if you have heard about the story of Datuk Lee Chong Wei. He was the Malaysia top national badminton player and also the top player in the whole world as well. So he was diagnosed with nose cancer a few years back. So you might be wondering, a person so strong, so fit as him, how could he get into cancer? And personally, I do believe that that was caused by his strenuous training, which actually depressed his immune system. With that, we have come to the end of this lecture. So to summarize, both our respiratory and cardiovascular systems respond to the increasing demand of oxygen during exercise. And that includes increased ventilation that can be achieved by increasing tidal volume and the oxygen consumption, VO2, or by increasing cardiac output, which is determined by two factors, namely heart rate and the stroke volume. But which one poses the real limit to the athletic performance? Is it your respiratory system or is it your cardiovascular system? Well, the answer is the cardiovascular system, as mentioned in my previous slides.